The human skeleton is a remarkable framework that provides structure, support, and protection to our bodies. It is an intricate system that not only gives us our shape, but also plays a vital role in our overall health and functionality. It is divided into two main parts, the axial skeleton and the appendicular skeleton. The axial skeleton forms the central core, while the appendicular skeleton includes the limbs and girdles that attach to the axial skeleton. The axial skeleton forms the central axis of our body, running from the top of our head to the base of our spine. This central axis is crucial for maintaining our posture and balance. It is comprised of 80 bones, including the skull, the vertebral column, and the thoracic cage. Each of these components has a unique and essential function. This essay will delve into the intricacies of the axial skeleton, exploring its individual components and understanding their collective role in maintaining our body's integrity. We will examine how these bones work together to provide a stable framework. Imagine the axial skeleton as the sturdy foundation of a house. Just as a house relies on its foundation for stability, our bodies rely on the axial skeleton for support. Just like a foundation supports the entire structure, the axial skeleton provides support for the rest of the body. It ensures that we can stand upright and maintain our posture. It also protects delicate organs like the brain, spinal cord, heart, and lungs. These organs are vital for our survival, and the axial skeleton acts as a shield, safeguarding them from harm. Without a strong axial skeleton, our bodies would be vulnerable to injury. The bones of the axial skeleton are designed to absorb shocks and impacts, reducing the risk of damage to our internal organs. The axial skeleton is essential for many of our daily activities, from simple tasks like sitting and standing to more complex movements like bending and twisting. The axial skeleton plays a crucial role. It allows us to stand upright, walk, and move with coordination. The vertebral column in particular provides the flexibility and strength needed for these movements. It also plays a crucial role in breathing, as the ribs and sternum work together to expand and contract the chest cavity. This movement is essential for the process of respiration, allowing us to inhale and exhale effectively. Understanding the axial skeleton is crucial for appreciating the complexity and functionality of the human body. By studying its structure and functions, we can gain insights into how our bodies operate and how to maintain their health. By exploring its individual components, we gain a deeper understanding of how our bodies are structured and how they function as a whole. Each bone, joint, and ligament plays a part in this intricate system. In the following sections, we will delve into the details of each part of the axial skeleton, starting with the skull. The skull not only houses and protects the brain, but also supports the structures of the face and provides attachment points for muscles involved in chewing and facial expressions. Perched atop the vertebral column, the skull is a complex and fascinating structure. It is not just a static bone, but a dynamic part of our anatomy that plays a crucial role in our daily lives. The skull houses and protects the brain, our body's control center, which is responsible for everything from our thoughts and emotions to our movements and sensations. It also provides attachment points for facial muscles, enabling us to express a wide range of emotions. These muscles allow us to smile, frown, and convey countless other expressions that are essential for human interaction. The skull is composed of 22 bones, which are divided into two main categories, cranial bones and facial bones. Each bone has a specific function and contributes to the overall structure and protection of the head. The 8 cranial bones form a protective shell around the brain, safeguarding it from injury. These bones are intricately connected, forming a solid barrier against external forces. The frontal bone forms the forehead, providing structure to the front of the skull and playing a key role in protecting the frontal lobes of the brain, while the 2 parietal bones make up the upper sides and roof of the skull. These bones are crucial in forming the dome-like shape of the skull, which helps to distribute impact forces evenly. The occipital bone forms the back and base of the skull, providing a sturdy support for the brain and connecting the skull to the spinal column, and the 2 temporal bones enclose the ears. These bones are involved in hearing and balance, housing the structures of the inner and middle ear. The sphenoid bone sits at the base of the skull, acting as a keystone that connects many of the other cranial bones. Its unique shape and position make it a central component of the skull's architecture. Lastly, the ethmoid bone forms part of the nasal cavity and the orbits of the eyes. This bone is essential for the sense of smell and contributes to the structure of the nasal passages. While the cranial bones protect the brain, the 14 facial bones give shape to our face and provide attachment points for muscles involved in chewing, speaking, and facial expressions. These bones are vital for our ability to interact with the world around us. Some of the notable facial bones include the mandible or lower jaw bone, which is the only movable bone of the skull and plays a crucial role in chewing and speaking. The maxillae or upper jaw bones, which hold the upper teeth and form the upper jaw and part of the eye sockets. The zygomatic bones or cheekbones, which are prominent features of the face and contribute to the contours of the cheeks. And the nasal bones or bridge of the nose, which support the structure of the nose and are involved in the sense of smell. The skull is a testament to the human body's intricate design, showcasing the remarkable interplay between form and function. Each bone, no matter how small, has a specific role that contributes to the overall harmony of the skull. Its robust structure ensures the safety of our brain, while its intricate arrangement of bones allows for a wide range of facial movements and expressions. The skull is not just a protective casing, but a dynamic and essential part of our anatomy that enables us to interact with the world in meaningful ways. The vertebral column, also known as the spine or backbone, is a strong yet flexible column of 26 bones that runs down the back of the body, extending from the skull to the pelvis. This intricate structure is not just a simple stack of bones. It is a marvel of biological engineering that provides both support and flexibility. Each vertebra is uniquely shaped to fit together perfectly, creating a column that can withstand significant stress while still allowing for a wide range of movements. It provides structural support for the upper body and protects the spinal cord, a vital communication pathway between the brain and the rest of the body. The spinal cord is like a superhighway for nerve signals, transmitting messages that control everything from muscle movements to sensory perceptions. Without the protection of the vertebral column, this essential communication network would be vulnerable to injury, which could result in severe consequences for bodily functions. The vertebral column is made up of individual bones called vertebrae, which are stacked on top of each other and separated by intervertebral discs. These vertebrae are not uniform. They vary in size and shape depending on their location in the spine, each designed to handle different types of stress and movement. The intervertebral discs play a crucial role in maintaining the integrity of the spine, acting as both spacers and shock absorbers. These discs act as shock absorbers, cushioning the vertebrae during movement and preventing them from rubbing against each other. Made of a tough outer layer and a gel-like inner core, these discs allow the spine to flex and bend while maintaining its strength. Over time, these discs can wear down, leading to conditions such as herniated discs, which can cause pain and limit mobility. The vertebral column is divided into 5 regions: cervical or neck, thoracic or chest, lumbar or lower back, sacrum, and coccyx or tailbone. Each of these regions has unique characteristics and functions, contributing to the overall versatility and strength of the spine. Understanding these regions helps us appreciate the complexity and adaptability of our backbone. Each region has a specific number of vertebrae and plays a distinct role in supporting the body. The cervical region, for example, supports the head and allows for a wide range of movements, while the lumbar region bears much of the body's weight and provides stability. The sacrum and coccyx, though less flexible, are essential for connecting the spine to the pelvis and supporting the lower body. The cervical region consists of 7 vertebrae and is the most flexible part of the spine, allowing for a wide range of head movements. This flexibility is crucial for daily activities, from turning our heads to look around to nodding in agreement. The unique structure of the cervical vertebrae, including the atlas and axis, enables this extensive range of motion. The 12 thoracic vertebrae articulate with the ribs to form the thoracic cage, providing protection for the heart and lungs. This region is less flexible than the cervical and lumbar regions, but is incredibly strong, designed to shield vital organs from injury. The thoracic vertebrae also play a role in respiratory movements as the ribs expand and contract during breathing. The 5 lumbar vertebrae are the largest and strongest vertebrae, supporting the weight of the upper body and allowing for bending and twisting motions. These vertebrae are built to handle significant stress, making them crucial for activities that involve lifting, bending, and twisting. However, this also makes the lumbar region susceptible to injuries and conditions such as lower back pain. The sacrum is a triangular bone formed by the fusion of 5 sacral vertebrae. This fusion creates a solid base that supports the spine and connects it to the pelvis. The sacrum's shape and strength are essential for maintaining balance and stability, especially during activities that involve standing, walking, or running. It connects the spine to the pelvis, providing stability and transferring weight from the upper body to the lower limbs. This connection is vital for maintaining an upright posture and for the efficient transfer of forces during movement. The sacrum also serves as an attachment point for various muscles and ligaments that contribute to the stability and movement of the lower body. The coccyx, or tailbone, is a small triangular bone at the bottom of the spine formed by the fusion of 4 coccygeal vertebrae. Though it is often considered a vestigial structure, the coccyx still plays a role in supporting the body, particularly when sitting. It also serves as an anchor point for various muscles, tendons, and ligaments. While it is a remnant of a tail from our evolutionary ancestors, it still serves as an attachment point for muscles and ligaments. These attachments are crucial for various functions, including the movement of the legs and the maintenance of pelvic stability. The coccyx also helps to support the weight of the body when sitting, distributing pressure to prevent discomfort. The vertebral column's remarkable combination of strength and flexibility allows us to perform a wide range of movements, from bending down to pick up an object to twisting our torso to look over our shoulder. This versatility is essential for daily activities and overall mobility, enabling us to interact with our environment in dynamic ways. Its segmented structure, along with the cushioning provided by the intervertebral discs, allows us to move with fluidity and grace, while its robust construction ensures the protection of our delicate spinal cord. This intricate balance of strength and flexibility is what makes the vertebral column such a vital component of the human body, enabling us to live active and healthy lives.